Hi everyone, today we're going to adopt a different video format. It's just going to be me sitting in this chair chatting with you about this very interesting topic. While also I'm going to wear my blue light filter glasses. Alright, so today we're going to talk about a great example of how a great data visualization can help educate and get that message across. And yes, the message and the data visualization are related to this weird pandemic that we're having right now.
Joining us, the World Health Organization has now confirmed what many epidemiologists have been saying for weeks. The coronavirus is a pandemic.
So Dr. Luis Hugo Francescuti, who's a professor in the School of Public Health at the University of Alberta and also an emergency physician, he mentioned that gathering in large groups, even outdoors, will be a difficult habit for many to break amid the COVID-19 pandemic. And I have to agree, it's something very difficult to break. I'm noticing a lot of people are still outdoors, a lot of people are still getting together. And I think this will be more difficult as the warmer months are starting to come in, and people will really be harder for them to be able to just stay indoors and not interact with one another. Take advantage of the great weather, go to the beach, go on a trail, go to a park, start having those barbecues, whatever activities people would have that would make them just really gather in larger groups, right? But people not practicing social distancing when outside need education. That's another thing that he mentioned. They don't need shaming, they need education. And I have to agree with this as well. I think one of the reasons why people don't really practice that social distancing very well right now is probably they don't quite get it. And I think they get the message, they understand the severity. Maybe that's doubtful, but they really, I think it's not really getting to them in an impactful way for them to act upon that message. And I think that a great data visualization could help with all of this, don't you think? So I noticed there was this article back in March from Washington Post. It was entitled, "Why Outbreaks Like Coronavirus Spread Exponentially and How to Flatten the Curve." We keep hearing this message, we need to flatten the curve. So I started reading through it and I found out that they were using a great deal of visualizations to get that message across of why social distancing helps. So let's really do a quick review of this and see how they were using all of these great data visualizations techniques to get that message across. And I think they really drove it very well. So initially they introduced this concept of the exponential curve, right? Something that we're all afraid of because we see spikes in the amount of people that are getting infected. And of course, they're getting really sick and some are also dying because of it. So this is what the exponential curve looks like. That has all the experts worried. Now this was back in March 13th, and we can see here there's only 2,179 cases in the US. Now of course we're in April, really not even a month later after this article was written, and just not even a month later we can see that in the US alone there are already 906,000 people infected. That's crazy. So we can see how that exponential curve is just getting steeper and steeper. What I like about this, it's starting to introduce the legend of the graphs that we're going to see further on. So in here, the orange represents a sick person and that blue grayish circle represents a healthy person. And when the two interact, well, the sick person gets the healthy person sick as well. It passes on the virus, they get infected. Now, of course, in reality, people eventually recover, at least the lucky ones. This gets represented by this purple or pink colored circle, kind of the color of my shirt, right? Kind of. Mine is a bit more purple. I think this one is a bit more pink. What I enjoyed about this, I think it's great that they did not introduce all the three colors to start, but they do that gradually. And I think that message really sticks. So now I think we have a clear understanding what a healthy person looks like. Yep, it's that gray, bluish circle. A sick person, it's the orange. and of course the recovered person represented by the purple or the pink. Now, they're going to run the simulation, and we're going to see it in this very data visual format on what happens when a virus spreads in a town of 200 people. So as we can see here, in a town of 200 people, we can see at the top graph, that's going to represent that graph. That's going to show the increase, and eventually it's going to start going over the hump that we keep hearing about, and it's going to go down, and we're going to see a decrease in the number of sick cases. Of course, none of these visualizations represent the number of dead people. But as we can see, really everybody gets infected, and ultimately everybody gets recovered. Again, in reality, we're not as lucky, and some people are dying as a result of it. But we can see that there's movement, everybody's interacting with everybody at one point, and they really all get sick quite quickly even. Now, this is another great visualization that they're putting across. So what happens if they're trying to introduce a forced quarantine, right? Such as the one in the Chinese government imposed on the Hubei province, which was the COVID-19 ground zero. As we can also see here, that gap between the left-hand side, the quarantine side, and the rest of the population is getting widened, because as health experts would expect, it proved impossible to completely seal off the sick population from the healthy. So at one point, one or more sick people would get out, and they would start infecting the rest of the population. Now, in both of these cases, in the quarantine and in the rest of the world, really there's no restriction in that social distancing. People are still moving, people are still interacting with one another. So still, what we can see here is that people are being infected, all of them. Now, what happens when we do practice social distancing, but when not everybody is practicing it? And this is where they're trying to get that message across. In here, just a quarter of the population continues to move around, while the other 75% are really practicing that social distancing. They're trying to stay in their homes. And as we can see here, they're still getting sick, sure, but that change over time is drastically lower. This is another example where even more social distancing is being practiced. This is 1 in 8 people are moving out of these 200 population that we see here in this graph. It takes so much longer for people to get infected, and it gives them enough time to recover before somebody else would get infected. So what do you think? I think this is a great way of using data visualization to get that message across and to really educate people. And this is what we need. We need more education. We need to be a bit more data savvy. We need to be a bit more data enabled. We need to understand this whole thing a little bit better. And, besides the thematic of today's video on COVID, I think we can all invest a bit more in our data education, understand more about data, its importance, why it needs to be treated as an asset, how it can be visualized in order to tell a story, in order to get a message across. We should all care about this, don't you think? Well, thank you very much for watching, and let me know if you do enjoy this format a bit more than the regular, studio format that you're more accustomed to. Thank you for watching, and please like the video if you've enjoyed it, and don't forget to subscribe to just be in tune with more videos that are going to come up every week. Thank you.